Fixing New York State's mental health care system is essential and long overdue. Even before COVID, the rates of mental illness had been on the rise. But since the pandemic, more than 1 in 3 New Yorkers have either sought mental health care or know someone who has. That's staggering. And the fact that too many can't get it. The barriers just seem endless. No appointments close to home. Insurance won't cover the care. Long waits for psychiatric beds in hospitals. What happens? People suffer in silence. Illness grows when it's not treated. So it's no surprise that the number of people suffering from mental illness also continues to grow. We have underinvested in mental health care for so long and allowed the situation to become so dire that it also has become a public safety crisis as well. New Yorkers are anxious on the subways and in our streets when they see individuals who need help, people unable to take care of themselves properly. People could cause harm to themselves or other. Not all, just some, a few. But those people are also at risk of being victimized themselves. So I'm declaring the era of ignoring the needs of these individuals is over. Because our success as government leaders is measured by our ability to lift up and support all of our constituents. So today marks a reversal in the state's approach to mental health care, and this is a monumental shift to make sure that no one else falls through the cracks. This will be the most significant change since the deinstitutionalization era of the 1970s. And I'm proud to announce to accomplish this goal, we are prepared to invest $1 billion, making critical policy changes to fully meet the mental health needs of our people. It's about time. Let's get it done. We can do this together. Let's get it done. Our people need this. Our residents are calling on us to do this. Let's get it done. Let's get it done. Right now, we have 3,200 New Yorkers struggling with severe mental illness or addiction who are living on the streets or in our subways. At the same time, we have insufficient number of inpatient psychiatric beds and services. We will add 1,000 inpatient psychiatric beds by funding 150 from the state and bringing 850 psych beds in hospitals back online, because that'll be half. That is more than half of the beds we lost since 2014 when all the disinvestment was happening. And they'll serve over 10,000 New Yorkers every year. These actions are long overdue, but here's the challenge. Last year, we were asked to increase hospital reimbursement rates to enable more psychiatric beds to be brought back online. We did that. My partners, all of you, $27.5 million provided additional money for the hospitals to bring psychiatric beds back online. Yet a year later, hundreds of those beds are still offline, and that's not acceptable. So we're going to insist they come back online, and I'll seek greater authority from the Office of Mental Health to ensure full cooperation in meeting these objectives. This is a moral imperative, and it's a public safety imperative. We'll also invest in services to allow patients to be reintegrating in a way that's safe for them and safe for their community. So our inpatient beds don't get backed up because more appropriate outpatient care is unavailable. We also know that supportive housing is an important tool for prevention and recovery. And that's why my plan proposes building 3,500 residential units supported by intensive mental health services. And we'll make sure that when patients move from one kind of care to the other, they don't get left behind. They don't fall off. Our plan requires facilities to discharge high-risk patients into intensive wraparound services. Wraparound services now. And I'll propose that insurance companies cannot be prohibited from covering these services. They can no longer deny mental health, critical life-saving mental health services. And finally, we're going to focus the mental health space on our children, because too many schools provide no level of mental health support, and our children need preventative services now to stop them from needing intensive services in the future. We aim to meet this unmet need and reduce it by half over the next 5 years. We've got to get this done. And while we're talking, whether we're talking about a child with behavioral challenges or an adult suffering from severe depression, no one should go without a screening or a doctor's appointment or counseling. And cost should never, ever be a barrier. And that includes those suffering from addiction, especially those struggling with opioids. There's too many families, including my own, who've endured the loss of a loved one. That's why we'll do more, working with our federal and local partners to stop the flow of illicit drugs into our communities, address the new deadly additives like xylazine. We'll send resources to communities that are trying hard to shut down the flow of fentanyl into our streets. And we'll keep expanding access to technology so they can detect deadly additives like fentanyl and xylazine before they're even used. That's how you save lives. And we can reverse overdoses. And I'll create a new interagency task force that'll examine every single possible solution and come up with recommendations. Because we must meet this crisis with the urgency that it demands.